Hello, I'm Ed Baker, and today I'm talking with Dr. Leah Devlin, a colleague and friend, as part of a research project on success for state health officials. This project is led by the Indiana University Fairbanks School of Public Health. Dr. Paul Halverson, a former state health official himself, is leading our work. We're sponsored by the de Beaumont Foundation and work closely with ASTHO. So, Leah, it's great talking with you again today.
I'm glad to be here with you, Ed.
Great, thanks so much. Let's talk first about your experience as a state health official, and as you think about it and look back on it, one of our questions is, what does success look like? What in your mind's eye does success look like when you think back about your term as a state health official?
Well, Ed, when I look back on my years as a state health official and think about what success looks like, I remember that we chose a few priorities because there's so many issues in public health that need to be addressed and that we're working on. But I decided what were the things that I wanted to be able to say during my time we made a difference on school health, on preparedness, on disparities, and building the public health infrastructure was another priority, and working on women and children's issues. So we had those 5 broad priority areas. And how did we move policy? Were we able to put new programs or shore up existing services? What were the partnerships we developed? And did we have impact in the end through those different strategies?
So what I'm hearing you say in terms of success, you set priorities, and then in a sense you measured your success based on the programs you developed, the policies you put in place, and that's the way you can almost determine whether success happened. Is that a fair way of looking at it in your view?
Yeah, I think that's exactly right. You set your priorities, you measure your outcomes, and your outcomes can be a range of things. One of the important issues for me was how visible was public health on an issue. What were our relationships with our partners? Were we creating new partnerships with important players, or were we refreshing old partnerships and finding new ways of working together? So it was how effective are you? How important do people want to engage with you on these issues? Because as we know, public health's a team sport and everybody's got to be involved. So it was some of that kind of relationship building, not just whether you decrease teen pregnancy.
Let's talk a little bit more about those factors. You've just touched on the factors and the sort of the way you went about being successful. I watched you in action when I worked in North Carolina, and one of the many things you did well was building those partnerships, particularly across non-traditional lines, like with the schools, with the General Assembly members, with other people in the state. Say a little bit more about how you went about doing some of those things that led to success, like building partnerships.
Well, the first thing about building a partnership is getting to know each other ahead of time, before you need each other. So I always thought about having a cup of coffee with a key leader in the community or another part of state government. Agriculture we always were picking at agriculture about tobacco or pesticide exposure. Well, when we became leaders in the world of preparedness after the anthrax attacks, that was a new way of working with an old partner. The preparedness opportunities also gave us a new way of working with hospitals. One of the things after the anthrax attacks that the federal government did very well was they dedicated resources and they got it out the door, and they gave us broad goals to develop our capacity around acts of bioterrorism. But one of the great strategies they did was they sent the money for the hospital preparedness through the state public health agency. So that drove a new way of working with hospitals. So, we had a lot of partnerships already. North Carolina is a partnership state. I think maybe some of that comes from being a hurricane state. We work together, right? And we know each other. But it also, the preparedness brought new partnerships to the table, like the National Guard and law enforcement. And some of these partnerships endure today with some of the other critical issues that we face. So the relationship building is essential for going forward and making a difference and living to fight another day. You need your friends in all aspects of our society.
Now, you've mentioned to me before the real challenges around preparedness. You just touched on that being a huge challenge. Say a little bit more about, if you would, that challenge. What was challenging about it, perhaps, and how you really dealt with it, which you've already touched on, Leah. That was a big challenge for you because you came in at a particular point in time. Tell us a little bit about that important challenge for you.
So I did start as the state health director in May of 2001. So the towers came down in September, and then the anthrax index case, the first man that was sick and died with anthrax, actually was from Florida, but he got sick in North Carolina. So we, along with Florida, were the epicenter for that very first investigation of an act of bioterrorism. And so right out of the box, we were going through hospital records and looking for where the exposure might have been and whether anyone else was exposed. So it was a time of high risk, high concern, and we right away knew we had to ramp up not just the investigation, but communications with the public and making sure that we were communicating in a timely, complete, and accurate way. Every day, every morning, every afternoon, there would be a media, either a press release, a media availability, a press conference where we had all of our partners together. But that public face of, we've got this, because actually it was a really great opportunity for us to illuminate actually who we are in public health, what our role is, that for 100 years we've been investigating infectious diseases and detecting early and responding rapidly so that we can contain the damage done when there is an infectious disease in the community or foodborne outbreak, for example. So we were able to demonstrate that there's a local health department in every county in our state. This is what they do. This is what we do. Now this has got a twist because it was intentionally delivered, and that's frightening and brings new partners for us to work with. But that we have the experts in the science, in the medicine, in the epidemiology. We know the community. This is what we do. And that was a really strong and powerful message for the community that really thought the health department was that clinic on the corner down the street. And we were able to say, no, that's important. Some of us do that, some of us don't. We do it in North Carolina. But our community health protection role is foundational, and we were able to demonstrate that.
Wow. It really opened people's eyes to a whole different aspect of things.
Yes, it did.
Now, you knew a lot about the state health department before you became state health director. You worked there. You worked in local public health before that. But when you took the position, I'm wondering if there was something that you wish you had known about the job, or what it consisted of, or what you needed to do to be successful, that once you are in the position, you say, gee, I wish I'd known about this or that. Was there anything like that happened for you?
So I had already, as you say, been in public health in North Carolina for over 20 years, had been a local health director, had been at the state for a number of years. So I knew the public health system in my state, I knew the issues, and I knew the people. So in looking back, so I sort of knew what I was getting into. But in looking back on that time, what I might have taken great comfort in and been inspired by is if I had had more of awareness of what a gift it was to have the opportunity to serve as a state health officer in a marvelous state, many challenges, to work with the team I had to work with, who were fabulous. I worked for a wonderful secretary, Carmen Hooker Odom, and a great governor, and just it was an opportunity to grow, to learn, to meet new people. By getting involved in an organization like ASTO and some of the affiliates, I had the opportunity to engage nationally. And that was just really life-changing. So I think going into it, knowing that there are going to be good days, bad days, you're going to have successes, and you're going to really mess some things up. But the bigger picture and the art of the long view is, wow, not a lot of people get to do this, and how wonderful it was. So it was a gift.
That's great. Now, you had that position for about 8 years or so, I
That's
think.
right. Mm-hmm.
And at some point, you transitioned out. You went on to do other things, which we'll talk about in a moment. Say a little bit, if you would, Leah, about sort of the impact of your transition and things that you did to sort of effectuate a smooth transition, things you did to sort of mitigate damage. Sometimes there's a transition that's very abrupt and it's not, planned out. But talk a little bit about your transitioning out of the position. What was that like? Particularly the impact on the organization and what was done to address that.
Well, I left my role as state health director after 30 years of government service and was interested in seeing if there were other opportunities to contribute from a different sector. But the impact on my leaving the organization was, I believe, minimal because we had a strong team and they had opportunities to develop their skills as leaders in the state level public health system and in their own national associations as well. They were visible. You're always torn between having the state health director as the face of public health that's communicating, that's branding the message, versus there's plenty of sunshine. Let's let these other really amazing experts talk about their issues in the public eye, so they are not only have they developed their skills, but they're visible. People know them, people trust them, the elected and appointed officials are invested in them. So it's a little bit of a succession planning process. And then thinking a little bit about when you leave. I thought it was important to leave when the lights were on, when things were going well, we were in good shape, we weren't in crisis mode, the budget hadn't tanked yet, we hadn't had Pam flu shortly after I left. Both of those things happened. So those are the kinds of things that can help with continuity of your own mission and your own goals, which are so important and you vested so much in. The other thing I think that's been a real wonderful opportunity for me, and I'm grateful for it, is that I have remained close to my colleagues in the Division of Public Health. I'm homegrown, I'm in the community, I'm still engaged in public health just from the academic sector, and they're very generous in allowing me to continue to be a part of their work, which is fabulous.
So you've really maintained those relationships over
They're
time.
very important to me, very valuable in my life.
Let's go back to one relationship issue that I think new state health officials sometimes need to learn more about. You work very actively with elected officials in the state General Assembly. Obviously, there's a governor's office. We'll talk about that in a moment. But could you say a little bit more about relationship building with people in the General Assembly who are elected officials around public health issues? What did you actually do? How did that go? You told me a story one time about the state lab and trying to you were all driving off on a trip somewhere and you were working with some of these people. But that part of working with elected officials is not something that a lot of people, I think, who become state health officials know about. Tell us about how that worked for you. What were some of the things you did that seemed to work?
Well, in my work with elected officials, I always was grateful for their service, that they stood for election, they made enormous sacrifices to be there with family and with their other careers. So the fact that they stood for election was impressive to me. When in working with them, so I was very respectful of them. I was also very, and still am, respectful of their role and what my role is. And I was pretty clear about understanding that my role was to bring the science on an issue, and based on that science, what my recommendation as a scientist would be, state health official, but recognizing that they have a different job and they have a different set of factors that they are using to make their decision, whether it's their constituent base or the economics of a situation. They have other responsibilities. So I'm there to give them my best guidance based on science. When you get off of your science, it's just a greasy slide downwards. So that's really important to stay there on your facts. And moving into advocacy is tricky. There are others that can do that for you. So working in partnership with others that are going in another way and another approach to do your advocacy work. Usually that's going to be, in my state, the local health departments were independent, so they could do that back home when they're seeing their constituents in the community or even in the legislature. And then the nonprofit sector is a very good partner in that way as well. The other thing is I always took someone with me. So you always had someone that made sure that everything was what you heard when you leave is what you thought you heard, that you're not getting pushed into a deal. You never want to make a deal with a legislator, you know. So that third person and someone from your team helps everybody stay on the path you meant to stay on when you went in there. So there's just little tricks like that.
That's an extra pair of ears there. There's somebody else in the room with you that's listening at the same time.
Yeah, and shoring you up.
Yeah.
And it's not just about you. It's your team, your system. I mean, you may take a local health director. When we worked on tobacco issues, we would go in when we were working on particularly the smoke-free bars and restaurants. Our most important partner when we would go in to see legislators was the head of the Restaurant Association. And it was interesting because the legislators, we've been working on tobacco 30 years, right, or more. They knew what I was going to say and what I thought, but they in that private office wanted to hear what that business guy had to say that was the leader of the restaurants. So we were there and we were there together, which was really important. Or we had a piece of legislation about where a legislator was really wanting to reintroduce unpasteurized milk to the food supply. So you go with your agriculture commissioner, and that's very powerful too. So you're careful about not only taking someone, but who you take is important also.
Yeah, picking the right person.
Right.
You've been doing a lot of interesting things since you left your position. You're at the Public Health School there in Chapel Hill. You're on the board of the Robert Wood Johnson Foundation and working with RTI. You've done a number of other things. You've stayed in touch with your colleagues, as you mentioned. Say a little bit about how your experience as a state health official really informed you or informed your work, your perspectives after you left the job. Mm-hmm. How has that affected, what you've done subsequently?
So I do have a wonderful opportunity to be on the faculty at the University of North Carolina, Gillings School of Global Public Health, and my role there is to connect the school, which is already very practice-focused. That's a real commitment of Dean Barbara Reimer. And my job is to increase their connectivity to the community in the state, particularly it's a state agency, so in the state, and help our school be a part of solving some of these, what we call the wicked, complex public health issues of our time, to be more of a player. The second part of my job is to increase the visibility of the school as a state agency with statewide leaders for what we are doing that makes a difference in our state, that we're not just about research, we're not just about teaching, both very important, but that we are very engaged in service in North Carolina. So in some ways the work is the same. It's about building partnerships, developing relationships, connecting dots, and being able to step back and see possibilities with really smart faculty and students, really tough problems and constraints that state government might have. That's particularly true when you work with a partner like RTI, which is a private think tank that does a lot of research on a lot of public health issues, and they can be more nimble than either our state agencies. So that's a great partnership. Now, in terms of working with the Robert Wood Johnson Foundation, which is an amazing institution, the work that they're doing, their mission around a culture of health, fits with what I've been about my whole life, which is community level engagement, helping and empowering communities to be engaged in solving their own problems, coalition building. So getting everybody to the table, that's really central to my life's work, and it's amazing and fabulous to have such an incredible foundation as the Robert Wood Johnson Foundation, really making a long-term commitment and focus to that work.
When you look at sort of the future of public health, you've already talked about this, Leah, looking ahead, state health officials, as you were, would need to have a vision of sort of where public health is headed, where it needs to go in this next sort of period of time. What are your thoughts there based on how you're seeing the public health landscape about the future and what particularly new state health officials might want to focus on?
I think it's really important in thinking about the public health system and the future, where we might need to be and how a state health director can help position their organization, is making yourself relevant in the community. What's going on in the community that's important. Of course, at the state level, it would be the whole state. One of the issues, for example, is the big disparities between rural and urban areas. And how can we work with our 100 health departments, or health departments that cover all 100 counties, to truly shore up the capacity there, to bring people together. Even the most rural communities have assets. They have schools, they have faith communities, and some business, they have elected officials. So how do you continue to make yourself relevant as a leader on the issues that are important in that community? And some of it is our time-honored work. If you're working in prevention, you're going to be working on preconceptual health and family planning and making sure that babies are born in the world healthy and wanted and ready to thrive, develop their brains. We know so much now about brain development and focusing on 0 to 3. So it's important for us to stay abreast of the science that's changing and stay focused on the science. It's also important to look for the tables that we need to be at when we're talking about whether it's healthcare or environmental issues or chronic disease, leading causes of death, and all the behavioral changes that go there. Probably understanding more and more about the science of how you actually motivate behavior change would be huge, right? Because we know where lots of health comes from is our own choices. The technology age that's out there, I think trying to stay fresh on just not only the technology advancements around communications and social media and how we do communicate with the public, but also the new technologies around precision medicine and genomics and the possibility of tailoring prevention messages and preventive behaviors to truly to an individual in a broad population approach, using our phones, using social media and things like that. So I think that we need to build on the lessons that we've learned, like preparedness. We talked about the need for good communications and new partnerships like with law enforcement that we developed, and we have an amazing opportunity now to bring those skills to bear on the crisis of our time, the opioid epidemic. As just one example, it's got the awareness of our elected officials. There's funding there. It's an enormous problem. Everybody's got to be engaged. This is work we know how to do. It can be prevented. It can be treated with training and working closely with our healthcare providers, which are partners that we can refresh that relationship. So, I mean, that's one example of an opportunity that's at hand. But there is the broader picture of being at the tables where important decisions are being made about health and health care, as well as looking long, chronic disease. We've not finished the book of business on tobacco, and we need to do that. I'm very concerned about where we're going with marijuana in this country, another inhalant in people's lungs and the cognitive challenges there. And then early childhood development, a major, major opportunity as we learn more and more about brain development and getting kids ready.
That's great. Final question. Your advice to a new state health official. I'm sure you've talked to people that are new in the job or considering the job. What advice would you give to a person that's a new state health official?
So some of the advice that I would give to a new state health official is to, first of all, remember it's about the issues and the system. It's not about you. So, do your best, and sometimes it's going to work and sometimes it's not. So, because this is hard work over the long haul. The second is to be transparent in everything you do. Be ready to read about it in the paper tomorrow, or be able to have a conversation with your mom or your grandmom about it, and let that be one of your guides. Surround yourself with good people, and be sure that you are supporting your leadership to the very best extent that you can. Work on your communication skills, and built those partnerships in the community along with the team that you have inside, because that's how you're going to be able to go forward.
Great. Leah, thank you so much. It's been great talking with you today.
Thank you for the opportunity. It's always good to be with you, Ed.
Great. Thanks so much.